So today's topic of discussion is the anatomy of the nose, and for that reason we will use Essentials of Human Anatomy by A.K. Datta for the theory as well as the diagrams. For discussing some applied anatomy, we will be using the book by Vishram Singh, Clinical and Surgical Anatomy, and for seeing the cadaveric diagrams, we will be using the Clinical Atlas of Human Anatomy by McMinn and Abram, and we have some cadaveric diagrams, and they are really good, and you will have a clear idea about the anatomical structures. So let's get started. So the nose consists of an external nose and the nasal cavity. The external nose is a pyramidal projection. You can see it's a pyramidal projection on the face. It has a tip, it's a free end or the tip or the apex, and a root. The round border between the tip and the root with the adjoining area is known as dorsum. This part is the dorsum. The inferior side of the nose consists of the nostrils. The framework of the external nose is formed by bones as well as cartilage. See, the upper part is supported by the bones, and the tip, the lateral side of the nose is cartilaginous. So which are the bones that form the nose? So they are nasal. You can see these are the nasal bones, the frontal process of maxilla, the nasal notch of the frontal bone. These are the bony structures, and the lower part is completely cartilaginous, and the cartilages are the anterior border of the septal cartilage, the upper lateral nasal cartilage, the lower nasal cartilages, and these are also known as the alar cartilage, a few minor alar cartilage, and fibrofatty tissue in the lower part of the alar. These all things I will show you later. Okay, so the skin over the bony area, that means this much part, is movable, but the skin over the cartilaginous part, that is this area, is immovable. Now we will study about the nasal cavity. The nasal cavity extends from the nostrils or the anterior nares to the choana or the choanae, and these are the posterior apertures, and I will show you later how the choana looks from an endoscopic view. And these communicates, the choana communicates with the nasopharynx. Each nostril is cartilaginous and bounded medially by a mobile septal cartilage. This is the septal cartilage, and laterally by the ala. Both wall meet at the tip of the apex of the nose. The picture that you are seeing right now is the endoscopic view of choana, and these are the posterior nasal openings. Okay, and this thing that you are seeing is a tube-like structure. This is the nasogastric tube, and these choana is made up of 4 bones, and those bones are the posterior free margin of the vomer. Vomer is over here, and medial pterygoid plate, the body of the sphenoid, and posterior margin of the hard palate. Now we will discuss about the boundaries of the nasal cavity. So the nasal cavity has roof, floor, medial wall, and that is the septum itself, and the lateral wall. So the roof has an anterior, intermediate, and a posterior part. Okay, so the anterior part is supported by nasal cartilage and frontal and nasal bones, and it slopes downward and forward. You can see this is the roof, and the intermediate part is actually made up of ethmoid bone. You can appreciate this area. It is made up of ethmoid bone, and usually the cribriform plate makes the roof, and the cribriform plate of the ethmoid bone is perforated by the olfactory nerves and ethmoidal vessels, and the posterior part is the sphenoidal part. Okay, it lies posterior to the nasal cavity and is continuous with the roof of the nasopharynx. The roof is horizontal and it is concave from side to side, and it is formed by the upper surface of the hard palate, the medial wall or the nasal septum. Now we will discuss this in details. So the medial wall is lined by the mucous membrane, except at the anterior most part where it is lined by skin and coarse hair is present over the anterior most part. Okay, and it is formed partly by cartilage. You can see these are the cartilages, and it is formed partly by the bones. These are the bones that forms the nasal septum. Now let's see how the nasal septum is formed. So firstly we will discuss about the bones. You can see this is the perpendicular plate of ethmoid. So the perpendicular plate of the ethmoid and the vomer bone. This is the part of vomer. This forms the principal part of the septum, and these are the bones that are mainly responsible for making the nasal septum. And there are few accessory bones like the nasal spine of the frontal bone, this one, and the nasal bone. These are the accessory bones. And the other bones that form the nasal septum are the cribriform plate of the ethmoid above, this will lie over here, and the sphenoidal crest, this one, the sphenoidal rostrum, and the nasal crest of the bony palate. This one is formed both by maxillae and the palatine bone. These bone fuses to form the nasal crest of the bony palate. So let's see the cartilaginous part. You can see the anterior and the inferior, or the antero-inferior part of the nasal septum is cartilaginous. The septal cartilage, this is the major cartilage that forms the cartilaginous part of the septum, and the septal process of the lower nasal cartilage, it is another minor cartilage, and sometimes a vomeronasal cartilage also intervenes between the vomer and the septal cartilage. You can see this one. This is the vomeronasal cartilage. So these are the bony parts and the cartilaginous part that takes part in formation of the septum. So now let's discuss about the arteries and the nerve supply of the nasal septum. Let me magnify it a bit. Yes, now it is done. See, it has the anterior and the superior part, or the antero-superior part is supplied by the anterior ethmoidal branch of the ophthalmic artery, this one, and the anterior ethmoidal branch of the nasociliary nerve lies at the anterior and the superior part. Okay, in the superior most part you can see the olfactory bulb is present above the ethmoidal bone, or the cribriform plate of the ethmoidal bone, and there lies the olfactory nerves which pierces the cribriform plate of the ethmoidal bone. Now in the anterior and the inferior part, this is the anterior-inferior part, you can see that there are few nerves and an artery. This artery is the septal ramus of the facial artery, and this nerve that you are seeing over here is the external nasal nerve, okay, in the cartilaginous area. And you can also see anterior superior alveolar nerve, this one, it lies in the anterior inferior part of the nasal septum. Now we will see the intermediate area. You can see the sphenopalatine artery is lying at the intermediate area and anastomosing with the facial artery branch of the septal ramus. And you can also see long sphenopalatine nerve lying in the intermediate area. The inferior most area of the nasal septum is supplied by the greater palatine artery, this one, and it anastomoses with the facial artery and the sphenopalatine artery over here. And about the nerve of the posterior part, you can see these are the short sphenopalatine nerve and branch from a greater palatine nerve. These lie in the posterior most part. And you can see over here that all these arteries anastomose in the anterior inferior part of the nasal septum. So this area is highly vascular because of the anastomosis occurring between the three arteries, and this area is also known as the Little's area or the Kisselbach's area of epistasis. You may see that in some small kids, those who poke their nose, they might damage the skin and the mucous membrane lying over these arteries, and they bleed profusely. So in that case, we should pinch the nose and tilt the head forward, and you can also apply some ice for the nose. So this will help in easy clotting of the blood. So this was the arterial and the nerve supply of the nose. Now we will talk about the venous drainage. The anterior superior part, it drains into the superior ophthalmic vein. The posterior inferior part, this drain into the pterygoid venous plexus, and the mobile part of the septum, that is the cartilaginous part, it drains into the internal jugular vein via the facial vein. Okay, so if any infection which occurs in this part can lead to the cavernous sinus via the facial vein or the pterygoid venous plexus. The mobile part of the septum is also known as the dangerous area of the face. The upper part of the septum means this region. Certain veins accompany the olfactory nerves and drain into the inferior cerebral veins. Now speaking about the lymphatic drainage from the anterior part, this is the anterior part, they drain into the submandibular lymph node from the intermediate and the posterior parts, that means over here and the posterior part, they drain into the retropharyngeal lymph node. Alright, and from the upper part, few lymphatics accompany the olfactory nerves and along the perineural sheath, that is the neural sheath which surrounds the olfactory nerves, and they drain in the CSF of the subarachnoid spaces. So this was all about the nasal septum. Now we will study about the lateral wall of the nose. Actually, numerous bones forms the lateral wall, and they are the nasal, the frontal process of maxilla, lacrimal bones, the middle and the superior concha of the labyrinth of ethmoid, inferior concha, perpendicular plate of the palatine bone, medial pterygoid plate of sphenoid. All these bones form the lateral wall. Now the inferior concha is a separate bone, but the middle and the superior concha, they are the part of the ethmoidal labyrinth. So this is the structure of lateral wall of the nasal cavity with intact mucous membrane. You can see this is the inferior concha, that is a curved bony part. This is the middle concha, and this is the superior concha. Above the superior concha there lies the supreme concha, this one. We can also see the sphenoidal sinus lying over here. This entire thing is the sphenoidal bone, and this is the body of sphenoid, and you can see the air sinus, air filled gap in the bone is known as the sphenoidal sinus, and this opens into the posterior part of the superior concha in a depression which is known as the sphenoethmoidal recess. The inferior concha, the middle concha and the superior concha has a space underneath them which are known as the superior, inferior and the middle meatus. The inferior concha is continuous in front. The inferior meatus is continuous in front with the vestibule, and it is continuous with the nasopharynx at the opening of the auditory tube. Now the image that you're seeing over here, we have the conchas separated out. The conchas has been cut out, and you can have the clear view of the structures that lie underneath the conchas. So let's start from the inferior meatus. The space underneath the inferior concha is the inferior meatus, and you can see the termination of nasolacrimal duct is present in the inferior meatus. Above it lies the middle meatus, and you can see a half moon structure which is known as the hiatus semilunaris. Let me magnify it. This is the hiatus semilunaris. It's a half moon like structure, and the floor of hiatus semilunaris has the opening of maxillary sinus. The anterior most part of the hiatus semilunaris has the opening of the ethmoidal infundibulum. This structure is the ethmoidal infundibulum, and the ethmoidal infundibulum receives the anterior ethmoidal sinus, the small bulging over here, and it also receives the opening of the frontal sinus through the nasofrontal duct or the frontonasal duct. Above it lies the superior meatus, which has the opening of the posterior ethmoidal sinus. And one more thing, you can see a bulged structure over here. This is known as the bulba ethmoidalis, and it has the opening of the middle ethmoidal sinuses. You can clearly see these things. The sphenoidal air sinus communicates with the nasal cavity through the sphenoethmoidal recess. this region. Now let's see some cadaveric images so that you can have a clear idea about the lateral wall of the nasal cavity. So you can see this is the vestibule, and you can see over here this is the opening of the nasolacrimal duct, this one. Over here the inferior concha have been removed partially. You can easily see the inferior meatus beneath the inferior concha. This region is the inferior meatus. This is the sphenoidal sinus, the gap in the bone you can see. This is the sphenoidal sinus. Over here you can see the sphenoethmoidal recess. It's a groove like structure, it's a depression which is marked as 16. It is the sphenoethmoidal recess. This is the superior nasal concha, 19 is the superior nasal concha. The part which is marked as 9 is the middle meatus, and the middle concha has been removed. And also you can see the ethmoidal bulba. This structure which you are seeing right now is the ethmoidal bulba 5, and the hiatus semilunaris, a half moon shaped groove. This is the hiatus semilunaris which is marked as 15. And also you can see the ethmoidal infundibulum. This structure is the ethmoidal infundibulum over here. In this diagram you can see the olfactory bulb. A comparative image is given of the real image. This is the olfactory bulb, and over here this is the olfactory bulb, and these are the olfactory nerves that lie in the superior most part of the nasal cavity. Now let's study about the arterial supply and the nerve supply. Let me zoom it. Yeah. So these are the olfactory nerves that was also present in the nasal septum, and this region you can see the superior most region of the nasal cavity. This is yellowish in color, and these are the olfactory nerves. For studying the artery and the nerves of the lateral wall, we will divide it into 4 quadrants. In the anterior and the superior quadrant, we can see anterior ethmoidal artery is over here, and accompanying it lies the anterior ethmoidal nerve. In the anterior and inferior quadrant, you can see the alar branch of the facial artery, the external nasal nerve, and the anterior superior alveolar nerve. And also you can see the greater palatine artery. This is the greater palatine artery. In the superior and the posterior quadrant, you can see the sphenopalatine artery over here, and posterior lateral nasal branch of the pterygopalatine ganglion. This lies over here. And in the inferior posterior part of the quadrant, you can see many nerves over here. These are the branch of the greater palatine artery, the pharyngeal branch of the pterygopalatine ganglion, and also the anterior palatine branch of the pterygopalatine ganglion. And you will also see some branches of the greater palatine artery in the posterior quadrant also. Regarding the venous drainage, the veins form a plexus which drains into the facial vein in front, the retropharyngeal vein and the pterygovenoid plexus behind, and into the inferior cerebral veins above. And now we'll see the lymphatic drainage. From the anterior half of the lateral wall, the lymphatics drain into the submandibular nodes, and from the posterior half it drains into the retropharyngeal and upper deep cervical lymph nodes. So this was all about the lateral wall of the